The five people that are left watching my channel for, gerontological research and things of that nature, I wanted to do a video series. It will take a series of videos as to why I don't take metformin. Metformin has become very popular in the life extensionist community, but I don't take it. Now, a couple of the factors that that metformin acts on, and before I start, I want to make sure that people know I'm not a doctor, I'm not a pharmacist, I'm not a chemist, I'm not a scientist, I'm not a nutritionist, I'm not a dietitian, I'm not an RN, I'm not an LPN, I'm not a nurse practitioner, I'm not anything like that. This is not medical advice. But the factors that metformin acts on that seem to make it, a longevity treatment is that it helps to basically help with certain aspects of diabesity. Now, what's diabesity? Diabesity is a modern pandemic which indicates the coexistence of both diabetes and obesity linked by various pathophysiological mechanisms revolving around insulin resistance and hyperinsulinemia. So insulin resistance is essentially your body doesn't respond to the insulin, it doesn't put the nutrients into the tissues. Hyperinsulinemia means that you have too much insulin. Diabesity has important diagnostic and therapeutic implications. Okay, let me move on here. So what's Syndrome X? Okay, the manifestations of Syndrome X is sometimes called metabolic syndrome. Okay, it's an increase of risk of coronary heart disease as much, if not more so, than elevated low-density lipoprotein cholesterol concentrations. The fundamental abnormality leading to the manifestations that comprise Syndrome X is resistance to insulin regulation of muscle glucose uptake and adipose tissue, lipolysis. To prevent decompensation of glucose tolerance, patients with Syndrome X secrete large amounts of insulin. Okay, treatment should be aimed at 1, increasing insulin sensitivity, 2, attenuating day-long hyperinsulinemia, and meaning cutting back on the hyperinsulinemia, making the body release less insulin. And 3, pharmacologic treatment of the specific manifestations of Syndrome X if lifestyle interventions are not entirely successful. The 2 major lifestyle modulators of insulin action are body weight and physical fitness. The heavier and more sedentary a patient is, the greater the degree of insulin resistance. So keep that in mind. Body weight and physical fitness are the primary driving forces of this issue. In overweight, insulin-resistant patients, the magnitude of insulin resistance is attenuated with weight loss. Aerobic exercise, 30 minutes a session, 3 to 4 times a week, is equally effective irrespective of the presence of obesity. In the absence of associated weight loss, the usually recommended low-fat, high-carbohydrate diet makes the manifestations of Syndrome X worse. So keep that in mind. The usually recommended low-fat, high-carbohydrate diet usually makes Syndrome X worse. This again has to do with hyperinsulinemia. This has to do with the consumption of high amounts of simple carbohydrates, which cause the release of more and more and more insulin. This is because the more carbohydrates present in the insulin-resistant patient's diet, the greater the insulinogenic stimulus to the pancreas, and hence day-long plasma insulin levels are higher, replacing saturated. Now remember, if people should look up the Zone diet or the South Beach diet. Replacing saturated fat with monounsaturated fat and polyunsaturated fat instead of carbohydrates. So taking animal-based fat, saturated fats, and replacing them with monounsaturated fats and polyunsaturated fats instead of carbohydrates provides the same favorable effect on LDL cholesterol concentrations without the insulin-stimulating effect of low-fat, high-carbohydrate diets. So if you eat a more balanced diet, it helps with this. This intervention does not affect insulin resistance, but maintains day-long insulin levels as low as possible, so it helps with the hyperinsulinemia, but does not help with the insulin resistance. Although lifestyle changes can be very effective in attenuating the manifestations of Syndrome X, it may be necessary to initiate pharmacologic treatment aimed at controlling dyslipidemia, meaning an imbalance of the fats, and hypertension. The major obstacle is to reducing the risk of coronary heart disease in patients with Syndrome X is becoming aware of its manifestations. So this is diabesity, the overview of an epidemic. Diabesity is the term for diabetes occurring in context of obesity. In this review, we will overview the latest epidemiological data available describing the rising prevalence, health impact, and economic impact of diabesity. We will also outline the measures required to slow down this newly evolving epidemic. The global prevalence of diabetes in 2010 was 284 million people worldwide, constituting, and I bet you it's even higher than that. That's only the known ones. Around 6.4% of the world population, which is higher than was projected in earlier studies. Okay. The prime aging mechanism that metformin acts on is the cross-linking mechanism of aging. The theories of aging, I believe, are all relevant. I believe they all have boatloads of scientific evidence to prove them. So what is the cross-linking theory of aging? While the aforementioned aging theories relate mostly to engagement or lack thereof, interactions, lifestyle, and sense of self, none of them address aging from a physiological level, blah, blah, blah. The cross-linking theory of aging, also known as the glycosylation theory of aging, attributes aging to chemical changes that happen in the body. These changes happen gradually as protein structural molecules, and DNA develops detrimental chemical bonds, also known as crosslinks to each other. When these crosslinks between molecules occur, they lose basic levels of functionality. As cross-linked proteins accumulate over time, they will damage cells and tissues, resulting in increased tissue stiffness and slowing down processes within the body. The cross-linking theory suggests that these molecular issues arise when glucose binds to protein. So when glucose binds to protein, this happens. This process occurs under the presence of oxygen, or oxidative damage, or oxidative stress, and as we age, there are increased odds that oxygen comes in contact with glucose and protein to activate the cross-linking transition. This is somewhat similar to how apple slices, a glucose-rich food, will gradually turn yellow and brown as they are exposed to oxygen in the air. Cross-linking of proteins may also play a role in hardening of collagen and cardiac enlargement, increasing the risk of cardiac arrest. Cross-linking is also associated with stiffening of blood vessel walls, delayed wound healing, reduced joint mobility, and changes in the lens of the eye. In addition to these potentially serious implications, many believe that cross-linking is responsible for age-related skin changes, including wrinkles and reduced elasticity. Okay, it is believed that cross-linking within the body is enhanced when there is a high concentration of sugar in the bloodstream. So what happens is, when you have lots of sugar in your body, and I highly recommend people read Dr. Atkins' age-defying diet. Dr. Atkins' age-defying diet. And I also recommend you read The Wrinkle Cure by Dr. Nicholas Perricone, which covers the cross-linking theories. The predominant theories covered in there are the cross-linking theory of aging. Other things, of course, like mitochondrial theory, stuff like that's covered too. Okay, so this further bolsters this idea. This idea is the fact that diabetics often have 2 to 3 times more cross-linked proteins in their body in comparison to non-diabetics. If this theory is correct, then foods with a high glycemic index, those that release sugar into the bloodstream at a rapid rate, should be reduced as much as possible to retain one's youthful appearance, not to mention one's youthful abilities and functions, By ditching the sugary sodas, simple carbohydrates, and processed foods, the onset of cross-linking molecules may be able to be slowed. So what are some of the common side effects of metformin? Okay, like all medicines, metformin can cause side effects, although not everyone gets them. Common side effects, these are the common side effects of metformin, happen in more than 1 in 100 people. There are things you can do to help cope with them. Okay, so feeling sick, being sick, diarrhea, stomachache, loss of appetite, a metallic taste in the vitamin B12 deficiency. Taking metformin can cause vitamin B12 deficiency. Call your doctor or contact 111, that would be 911 here, if you feel very tired, have muscle weakness, have a sore red tongue, have mouth ulcers, have problems with your vision, have pale or yellow skin. This can be less obvious on brown or black-skinned folks. Your doctor can check your vitamin B12 serum levels. If they are too low, they may prescribe B12 vitamin supplements. Okay, low blood sugars. Early warning signs of low blood sugar: feeling hungry, trembling, shaking, sweating, confusion, difficulty concentrating. Low blood sugar may happen if you take too much of some types of diabetes medications, such as metformin, do not eat meals at regular times or skip meals, are fasting, now keep that in mind, are fasting. This is an issue because a lot of people have jumped on this fasting bandwagon without considering the side effects of fasting. Okay, do not have a healthy diet, are not getting enough nutrients. Change what you eat, exercise too much without eating enough carbohydrates, drink alcohol, especially after skipping a meal, take some other medicines or herbal remedies at the same time, have a hormonal disorder such as underactive thyroid, hypothyroidism, have kidney or liver problems. To prevent hypoglycemia, which means low blood sugar, it's important to have regular meals, including breakfast. Try not to miss or delay a meal. If you're planning to exercise more than usual, make sure you eat carbohydrates like bread, pasta, or cereals before, during, or after exercise. Always carry a fast-acting carbohydrate with you, like sugar cubes, fruit juice, or some sweets, in case your blood sugar level gets low. Artificial sweeteners will not help. Okay, so keep that in mind. I don't know how somebody wouldn't know that, but yes, a sugar-free sweetener will not raise your blood sugar. What do you know? You may also need to eat a starchy carbohydrate like a sandwich or a cookie. This is British, so biscuit means cookie, to maintain your blood sugar for longer. Call your doctor, blah, blah, blah. Serious side effects. Okay? Serious side effects are rare and happen in less than 1 in 1,000 people. Serious allergic reaction. Long-term side effects. Taking metformin can cause B12 deficiency. This can make you feel very tired, breathless, faint, it can also cause anemia from B12 deficiency. Other side effects, and let's move on. Metformin and type 2 diabetes. Okay, metformin is often the first medicine you'll take if you have type 2 diabetes for many reasons. It helps in bringing down your blood sugar level in 3 ways. It tells your liver to make less glucose. It lowers your insulin resistance, which means it makes your muscles use insulin better, so glucose can get into them instead of staying in your bloodstream. It helps your intestines absorb less glucose from your food. It can lower your A1C, the average of your blood sugar control, over a few months. It can also delay prediabetes from becoming diabetes. Okay, so metformin medications, these are different names of metformin. Okay, so there's Fortamet, Glucophage, Glumetza, Riomet. All of those are pills except Riomet, which is a liquid. Some combination pills have metformin with another medicine, including glipizide and metformin, whatever and metformin, something else. Like any medicine, metformin can have side effects. Most are mild, but a few can be serious. Okay. So, common side effects of metformin: bloating, gas, diarrhea, belly pain, constipation, little appetite. Taking metformin with food can help you if you increase your dose. Okay, these side effects, taking metformin with food can help. If you increase your dose, these side effects may return. Meaning, taking your metformin with food may help reduce some of the side effects. However, if your dose increases, it might not help anymore, or you know. So while doctors used to avoid prescribing this drug to people who've had kidney trouble, it may be okay for someone with mild to moderate kidney disease. So you probably shouldn't take this if you have kidney disease either. You might see the shell part of extended release pill in your poop. Oh, that's wonderful. If you do, don't worry, the medication has gone into your body and you shouldn't take any extra pills. One large study has linked the long-term metformin use to higher chances of getting Alzheimer's disease and Parkinson's disease. Okay, so keep that in mind. One long-term study has shown that people that take metformin get Alzheimer's disease and Parkinson's disease. Rare side effects of metformin: some people reported heartburn, headaches, upper respiratory tract infection, and bad taste in the mouth, and they took extended release metformin. Up to 12% of the people on regular formula had those side effects. They also reported flu-like symptoms: sweating, flushing, heart palpitation, rashes, and nail problems. Serious side effects. One of the other things is metformin decreases your ability to grow your muscles and maintain muscle mass. I'm amazed nobody's talking about this. Serious side effects of metformin: lactic acidosis. This is a dangerous condition caused by the buildup of lactic acid, a chemical that your muscles and red blood cells make naturally. When it happens while taking metformin, it's called metformin-associated lactic acidosis. Okay? The problem is very rare, happening in a tiny fraction of people who take the drug. Okay, let's see here. It's more likely, this lactic acidosis is more likely to happen if you have kidney or liver disease, drink a lot of alcohol, have severe congestive heart failure, are sick with fever, diarrhea, or throwing up, or are dehydrated. Vitamin B12 deficiency. A lack of B vitamin can happen to anyone, but the risk is higher on metformin, especially over time. When you get enough, it can cause peripheral neuropathy, the numbness or tingling in your feet and legs that's already a risk for diabetes. It can also cause anemia, low levels of red blood cells. Ask your doctor to check your B12 level regularly. Don't wait until you have symptoms. It's also a good idea to add foods naturally high in B12 to your diet. Beef, liver, and clams have the most. Chicken, beef, eggs, dairy, and fortified cereals are good sources also. Supplements can also bring your levels back to normal, especially if you're a vegetarian. Just talk to your doctor. Hypoglycemia, low blood sugar again. Who's at risk of serious side effects? If you've had an allergic reaction to metformin or other medicines, have diabetes that isn't under control, have liver or kidney problems, have severe infection, recently had a heart attack or heart failure, have breathing or blood flow problems, drink a lot of alcohol. Managing metformin side effects: ask to start at a low dose, take metformin. Now that's what drives me nuts. A patient should not have to ask their doctor to start at a low dose. The doctor, in my opinion, should know to start people on the lowest effective dose. Take metformin with food. Ask about the extended release form of metformin, metformin drug interactions, Okay, metformin can cause problems with other drugs you are taking, including diuretics, glaucoma medications, corticosteroids, thyroid drugs, birth control pills, and other estrogen drugs, and calcium channel blockers. Now, this is what people need to understand also with medicines for acid reflux. Okay, think about this. You might need, at some point in your life, to take any one of these other drugs, okay? So if you're not a diabetic, if you're taking metformin for longevity-enhancing properties,